Tooth setting tips. Start with the maxillary bite rim first. The central incisal table touching the glass plate and the labial surface in line with the bite rim. This is how you should keep it first. Then the lateral incisors, 1 mm above the glass plate and along the long axis, directed more labially with the cervical portion pushed bit palatally. This is how you have to set the lateral incisor. The canines, canine tip touching the glass plate with the long axis perpendicular and the labial surface in line with the surface of the bite rim. So this is how you have to set the canine. Let's see first premolars. First premolars, the buccal cusp touching the glass plate and palatal cusp 1 mm above the glass plate. So this is how you have to set the first premolar. The second premolar, both the buccal and the palatal cusp should touch the glass plate. Both the premolars, buccal surface should be in line with a buccal surface of the rim. So this is how you should set the premolars. Let's see the first molars. The first molars, the long axis should be inclined buccally so that the mesiopalatal cusp should be the only cusp which should touch the glass plate and all the other cusps are 1 mm above the glass plate. So this is how you should set the maxillary molars. Now the maxillary second molars, they are of the same position as first molars, but the mesiopalatal cusp closer to the surface of the glass plate but not touching it. So this is not touching, the first premolar is touching. So now let's come to the mandibular arch. In the mandibular arch, the mandibular incisors should be 2 mm above the occlusal plane of the bite rim for the overjet and the overbite, with the cervical position pushed lingually so that they are labially inclined. The incisal edges should not be in contact with the palatal surface of the maxillary incisors. So this you should know. Let's see the canines. The canines be placed upright with long axis perpendicular to the occlusal surface and the tip of the canines should be engaging the occlusal embrasure between the distal slope of the maxillary canines and the mesial slope of the maxillary first premolars. So this is how the canine should be. Rest of the mandibular teeth, how we should set. The rest of the mandibular teeth should be set in accordance with the labial cusp coming in contact with the central groove of the maxillary teeth. So this is how you should set the mandibular teeth. The palatal cusp of all the maxillary teeth resting in the fossa of the mandibular teeth and the buccal cusp overlapping the buccal cusp of the mandibular teeth. So the buccal cusp of the upper should be overlapping the buccal cusp of the mandibular teeth. So this also you should be aware of it. So dear friends, so I hope I have given you some quick revision. So listen to this video again and again so that you will be thorough in the teeth setting. When you go to an exam, you can just watch this video and you can understand the teeth setting very easily. Thank you so much. If you like this video, share this video with your friends so that they also know how to do the teeth setting correctly. Thank you and God bless you.